I now yield 2 minutes to the Congress's pharmacist, the gentleman from Georgia, Mr. Carter.
The gentleman from Georgia is recognized for 2 minutes.
I thank the gentleman for yielding. Mr. Speaker, I rise today to speak against House Resolution 826, a resolution that was hastily put together that opposes the administration's Healthy Opportunity Demonstration Initiative in Medicaid. The use of waivers to grant states more flexibility in managing their health care systems is foundational to health reforms from both parties throughout the years. In fact, most Medicaid programs across the country today are currently operating under some form of waiver. In the latest waiver proposal, the Trump administration would allow states more flexibility to manage their Medicaid expansion population by choosing to accept their federal funds in a per-person or lump sum basis. States would be able to take that federal money and more efficiently treat these patients and then share in the savings. The Medicaid program was built to be a safety net for our children and the poor, not to be our nation's largest insurer. This waiver would not affect how Medicaid cares for children, seniors, or those with disabilities. The Healthy Adult Opportunity Waivers are designed only to help states manage the rapidly ballooning costs from able-bodied adults who are now on Medicaid after Obamacare. Medicaid benefits and patient access to care will not be cut in this proposal. Any state pursuing a health adult opportunity waiver will still be held responsible for the accessibility of services to beneficiaries. As much as my friends across the aisle seek to demonize this proposal and use every scare tactic in the book, this is sound policy to help the growing number of states struggling to manage the costs of their growing Medicaid programs. I commend President Trump, Secretary Azar, and Administrator Verma for their work and urge my colleagues to vote against this resolution.